right, so what are asynchronous appointments? I'm going to go over that and how to do them here in this video right quick. I say quick, but I do talk a lot. Anyway, regardless, an asynchronous appointment is, by definition asynchronous, so it's out of sync with current real time. And what that would mean, how it would differ from a regular appointment, is that, a regular appointment works sort of like a Zoom call or a FaceTime call where I start the call, you pop up, it's just like a telephone call except with video, and we chat back and forth in real time. An asynchronous appointment is going to be out of sync to where I record a video, send it to you, you record a video, send it back to me in response. However many times it takes, to get the job done. That could be just a couple back and forths, or it could be several, whatever it takes. An example would be, I send you a video to kick things off in the morning saying, hey, how you doing? It's time to do your asynchronous appointment. I see, you're currently on XYZ medicine. Last time we spoke, we got labs and they looked like ABC. Looks like the last time I sent in a refill, though, was October. Are you needing a refill now? It seems like you should. Do you have any questions? Is anything new happening? Anything I need to know about? Boom, that's recorded. I send it to you. You watch it when you get time. You don't have to respond right away. Let's say I sent you that at 8 o'clock in the morning, and then 2 o'clock in the afternoon, you finally get time. You record your response, and you say, hey, no, yeah, I do need a refill sent. Feeling pretty good, wondering about this huge hair that's growing out of my forehead. Is that normal for this point in time on testosterone therapy or whatever? And other than that, I'm good with questions and such. So you've recorded that and you send me that video. Comes back to me when I get a chance. I've watched it. Let's say you sent that to me at 2:15 and at 3:30 I get a chance to watch it, and I record my response and send back at 3:45 and say, that hair growing out of the side of your forehead, not normal. You might want to get that checked out, get some electrolysis done. Sounds kind of weird. Anyway, and I say, okay, I'm going to go ahead and send you a refill now. The next time you need labs is going to be in May. I'll send you an order then. And then I've closed that out and send it back to you. And you're good to go. You're like, well, I don't really feel like recording a video message just to say, okay, we're good. You can, if you choose, just go and select to record an audio message or voice message there, which is in the same spot where you will, in a minute, be instructed on how to access and spruce and record a voice message. Or you can just text your response and say, okay, all good, thanks, or whatever the case may be. Or you can record another video, or let's say suddenly another question pops in your head and you're like, oh crap, let me record it. Hey, sorry, I forgot to ask about this particular pharmacy I heard about. I heard that they have better prices and things. Do you think it would be okay to move my medicines over there, or do you think it's a good idea in general? And then I heard this thing from my health insurance and yada yada, and send that to me. And that's fine. Whatever you need to do there. But also know that, if you're uncomfortable or unable to continue to record video responses, you can opt, if you should choose, to record either voice notes or just text back. And that's perfectly acceptable as well. It's according to your comfort level. We're trying to make these appointments more accessible and more flexible for people, because we have a lot of people that work really weird schedules, and so they have trouble getting an appointment fitted into their day, or they might live or work or whatever, be in an environment that's very unsupportive, potentially hostile to their transition. And so we're trying to make it easier for them to accomplish their visit so that they don't have to sit there and worry the whole time that they're seeing us that is someone else listening, is someone going to walk in or anything. No, you can wait until you're comfortable and feel safe to do so, and then record your questions and responses and things. Anyway, so without further ado, I'm going to insert a video of me kind of walking through some screenshots taken from my phone on how to do this. It's not rocket science or anything. You may not even need to really watch this to figure out how to do it. This was just kind of an overall explanation of what asynchronous videos are and how to do them if you need it. So you could turn it off right now if you think you can pretty much figure it out from the written instructions that I also can send. So anyways, okay. We're looking to do an asynchronous appointment. I'm going to kind of walk through the screenshot instructions with you a little bit. And so also, keep in mind when we're going through here, this is going to be screenshots from my iPhone, and you may have an Android, you may have a Google phone, you may have some other kind of version. Now, it should look similar whenever you go into the Spruce app itself, but just keep in mind things may look a little bit different. So here we go. So here, whenever we go into a Spruce chat, is where we'd see messages back and forth between yourself and your provider. In this case, I've just sent myself a whole bunch of test messages to this patient, Testerson. I'm a dork. Anyway, so I've sent myself some messages just so you see them on the screen here, so it looks a little bit more like a normal conversation. And here in the chat box would be where you would text back and forth, right? So under this text box somewhere, there should be a little option button of some sort. On my screen, it looks like a plus sign. And so you click this plus sign icon and it should open up over here on this other screen, your options here. Now you would think to do a video message back and forth that you would click video, but from what I found on my iPhone anyway, video doesn't really work unless you have pre-recorded a video, which is also an option. If you have pre-recorded a video with your phone, you can click video and select the video that you recorded and send it here. Perfectly fine. But if you want to record your video message directly from Spruce, then you click the camera button here, at least on iPhone anyway. You click the camera button and it will open up the camera app. Now, when it does that, at least on my iPhone, see my poor out of focus clock on the wall, it opens up and it opens up on photo. And so you need to then change it to video whenever it's opened up your camera app. So changing over to video brings it here. So then we're ready to record, in which case when you're ready, you press the record button. Of course, I would have to hit, this button so that it uses the other camera on the back of the phone to show my face while I'm talking. But regardless, when you open up your camera app, you will make sure that it's on video and not photo. And then when you're ready to record the video, you hit record. Now, go ahead, record your video. Of course, I don't have screenshots of that, but when you're done with the video and you hit stop, it should give you then the option to either retake the video if you did like myself and really stumbled over your words the first time or something like that, or if you want to use the video, you can go ahead and click use the video. In which case it's going to bring you back to the regular Spruce screen. It'll have the little video here in the chat box where you can add some text with it if you want to, or otherwise just click send. In this screenshot, I've already sent the video because I'm a dummy and I forgot to take a picture of it when it was still here in the chat box. But regardless, it looks like any other text message that you might send, just sitting here in the text box ready to send, and then you hit the little send arrow over here and it goes bloop and it will send it in the chat, during which time then it will pop up in your healthcare provider's feed and then they can watch it when they get a chance and make their own response video back to you. Hopefully that kind of cleared up the process. If you have questions, of course, you can always ask. Like I said, just keep in mind everybody's phone is probably going to look a little bit different. And it may have like slightly differently worded options, but overall the process should be the same, where you start from your chat screen, select an option button, and go into some sort of camera or video option to record your video response, and then when you're done, end up sending it here in the chat. Okay, well, hopefully that was helpful, and let me close out of this part of the presentation. Alrighty, so hopefully the clip and the explanation that came before it helped you out figuring out how asynchronous videos work for as far as appointments. It's kind of like Snapchat, I guess. You know, you could send a friend a video and later they respond with another video of their own, something like that. And like I said, you know, if and when you are uncomfortable or unable to do a video portion, you can either send a voice note or a text in response to your healthcare provider's message as well. So hopefully this will make things more flexible, more accessible for those who have a lot of anxiety surrounding these appointments for one reason or another, you know. And if you have any questions, of course, you can always ask us. All right. Stay safe out there.